what you need to know about occupational therapy and acute care, the information that you need to know, and what to study, how to study. I'll be putting all those resources down in the links below, so you have something to refer to as I'm going through the resources. You can be looking at them in the description box below. All right, so how many of you guys are nervous for field work? You have acute care, you know that you're gonna have to know all of the medical stuff. You're gonna have to be talking to doctors and having to know what the heck they're talking about. They're talking a secret language. Well, to ease all those nerves, I got you guys, because you are gonna join me as I reminisce on my acute care days and take you into all the things that I took with me to acute care. Here we go. All right, just kidding. I did not take all of this with me literally, but I did take the information that I had been studying, reviewing from the books and from resources that my supervisor actually helped to provide me with. So let's take a look at them all together. And the very first one that I have, so a lot of this video is kind of like what I kept in my pockets. And if you can bring a pouch, a small pouch with you to your acute care and carry that around, then what you bring in your pouch or what you leave in your locker and study while you're eating lunch or on your free time, if there's downtime, which that rarely happens, but if there's downtime, then you can be studying all of this in your locker or in your space. So what I carried around with me in my pockets and in my brain included this nifty sheet that I had shown you guys and told you guys about before. It's the one that I made, and if you're interested to know what is this, it's a chart. It's for chart reviewing. I made it so that I have 10 patients. I can have the information of all 10 patients on one sheet. And in another video, in a few other videos actually, I talked about this, so please check out my channel. Subscribe and like before you go in, or as you're going in and you're like, oh, I like this. Please subscribe, please like, yay! And then I will have a video on this, and you'll find this in my resources in the description box of that video. It's something like Document Like a Pro, and the different ways of documenting acute care. You'll have to find the videos. Actually, better yet, I'll put them in the link for you guys. Whew, that takes it off for you guys, all right? I'll make it easier and put it in the link, put the links to those videos. If you're interested, I'll put those links in the videos in the description box below. Okay. So this is for chart reviewing, so that it's easy for all to look at all of the patients and get all the key information. When you head into the room for the patient, you'll know that, okay, this patient has these precautions, things that you have to be aware of, and make sure you don't go over that based on doctor's orders, and who has been involved in their care. Patients might ask you why they're in the hospital, what happened to them, and you can debrief them with your chart reviewing skills. Next we have, so from your, in another video, I'll talk about if you're starting your fieldwork completely fresh, completely new, and you're worried about all the things that you need to bring to your fieldwork on day one. I will include this in that video about what typically, at least in my program and what I've heard from my supervisor, that most students bring the documentation that they need and what he or what your supervisors typically may expect from you on day 1. I'll have another video if you're interested. So let me know in the comments below if you want a video on what to expect on day 1 and what to bring to your field work. All right, I'll be looking for that. Okay, so actually I need this. So I was saying that in occupational therapy, in acute care, you're working with a bunch of different providers. You're working with the doctors, the nurses, surgeons, I mean they're doctors too, but you're working with a bunch of people who speak the medical language, so you need to be able to speak it too, understand it. On day 1, I had to have this with me. I needed to have my little dictionary of what the heck are these OT abbreviations and acronyms that people are using, like what is ADD, what is AD, what is, all I knew was ADL, activities of daily living. But there's other stuff, there's tons of other stuff, and this is just page 1 with A and B. Gosh guys, there's a lot. But having this resource, carrying it around, is super helpful. And again, I will be putting these links. I found them from external sources, but I'll be putting them in the links below because I researched everything as I was figuring out, oh, I need to know this. Oh, I forgot this. I need to know this. So I'll make it easier for you guys. I hope this is easier for you. Please do like the video and subscribe to the channel if you find that this has been helping you. That's so great. I want to know that. I'll put the descriptions and links for these resources in the description box. I'm still debating though, I might try to make it a Google resource that I'll have to make it more organized. I'm probably going to make it as a Google resource for all of you guys to access, and you just click the link and then you'll find everything. So don't be overwhelmed, you're going to find more than just this in there, because I'll have a plethora of resources that you can access, but it'll be organized in folders. So I hope you know how to navigate folders, guys. Okay, so yeah, there's a lot of different abbreviations that you need to know. CAD, what is that? There's a lot of abbreviations for medical diagnoses, conditions, and you'll need to know all of them, because when you're reading the chart reviews, you can spend forever looking up all of this, typing it into Google. Why not have a sheet for you where you can just go alphabetical order? OOB, oh, that means out of bed. POC means plan of care. PRN, what the heck does that mean? As needed. So lots of stuff that I found this very, very helpful. So I'm putting it in the description box for you guys. I mean, Google folder. And then we have, someone gave this to me. They had found it because they're looking for laboratory values, and actually it is important to know the laboratory values, especially for the hemoglobin and potassium, as I was taught by my supervisor, that those are the levels that you look at to see is something going on with the patient. Could they be having dizziness or symptoms that are going to affect your care for them? So we did have one patient whose potassium had sunk way below the recommended level, and you could see it in the session because they were feeling very dizzy. They almost felt like passing out on us. And then in other sessions we've had low hemoglobin, and for those patients, they had oftentimes, if they got up too fast, they had to go back down or take things nice and slow because they're feeling dizzy, lightheaded, sweating, and so things like that. And then you also want to, I know it's kind of sounding like I'm talking about orthostatic hypotension, but that is also another thing that you want to look at their vital signs. If you notice symptoms for the patient, look at their vital signs. So go get, if it's not in the room, go get the device that reads their blood pressure and oxygen and heart rate. And also, in the case that you might see a person who has low hemoglobin, you might want to even bring that device into the room before you start the session. Because once you get the patient up, you have to figure out, do a lot of improvising from there. So this is super helpful because it gives you ideas. It is for the Physical Therapy Association. I didn't find one for the Occupational Therapy Association, but it's very helpful. It shows all the things, and this is me just marking it up. It shows like for deep vein thrombosis, DVT, what the care should be like based on those guidelines. So it provides guidelines. Here's sodium, what you can expect if they have too high or too low, what symptoms to look for. So it's a really good resource. And again, that'll be in the description box in the Google folder. Then we have this that is more common abbreviations. So I just use a few different sites for abbreviations to get more stuff. You have BIG means twice daily. BM is a bowel movement. So there's overlap between this one and the other one, but I'll put both of these resources up for you so that you can see them. And then here are some side things that I had, which was for assessments. We are not required to do this. We were not required to do this in our setting, but you might find it helpful for yours. I just brought them in case I thought maybe this might be important to do with the patient, and it's also for learning. I need to know how to do these assessments, and my supervisor was more than willing and happy to let me do that. So again, talk with your supervisor if you want to add in assessments and do those with the patients. Ask if that's all right, and likely they'll say yes. If they don't want you to do it, they'll let you know. So we've got the safety questionnaire for assisted living, and this honestly, someone gave this to me, but I didn't really use this unless they actually did live by themselves in assisted living. Or sometimes I thought, you know what, this might actually be applicable if they don't live in assisted living. If they live somewhere else, say if they just live in their house by themselves, it could be useful too. So I rarely use it, but when I use it, I found it a good learning opportunity. Then we have the slums. Now I'm sure you guys have seen this in the program or will see it if you are maybe like an OT 2B student, pre-OT, woo, go you. Then this is something that you'll see for cognitive tests, the slums examination, and it goes through all the different executive functioning and cognitive skills. Not all of them, but most of them. And then this, let's see. This was provided by my supervisor. He recommended if I'm not sure of where to discharge a patient, what my recommendations for discharge are, because in acute care you do a lot of what you're doing is consultation for the doctors. I mean, I shouldn't say it like that, but in a sense, one of the services you're providing is consultation for the doctors to know where's the best place for discharge. So you're advocating for the patient, their safety, and what you think is the best next level of care, whether that be back at home or with their family, not with their family, or in skilled nursing or a specialized care unit. And here it's called the 6 Clicks from Boston University. It's an APMAC. Again, I'll put this in the description in the Google folder that I'll be putting the link for in the description box. You'll have access to everything that I'm showing you. And to be honest, I might forget where I found a lot of these. Not a lot, but some of these. So I might provide a different link in the Google folder than what I'm showing you here, but it'll be as similar as I can. But for the most part, I think I know where they're all from. So the 6 Clicks, Boston University, this home care SNF, long-term acute care placement. Maybe if you're interested, I can show you what this is in another video. This video is going to be too long if I tell you about it now. But this is essentially to help you with designing discharge plans. So it's another kind of assessment for scoring. And if you want to know more about that, I can show it to you in another video. So write in the comments below, guys. That's the only way I know what you guys want. And I am here to listen to you guys. I want to hear you guys. I get so excited when I see people write things in the comments. So please do use that comment box to say whatever is on your mind. And whatever you want to see, ask me, because it doesn't hurt to ask. I'm more than happy and I'm so happy when I see you guys talking in the chat. I'm like, oh my gosh, this is so awesome. You guys like this stuff. You guys find it helpful. It's actually helping people. That tells me that, oh, I think that this channel should keep going. So if you like what you're seeing, and if you want more stuff from me, please do subscribe. And please do like and subscribe, because otherwise I'm not quite sure if this channel is helping, and I would try to keep it going, but if it's not really helping people, I need to know. All right, so this is so important, guys. This is like a lifesaver, because you need to know your precautions. You need to know if a person just came from cardiac surgery, had a pacemaker placed, or they have a halo that's inserted into their skull. What are precautions? If they had hip surgery, shoulder surgery, what precautions do they have? What can they do? What can they not do? What do the doctors want them to do and not want them to do? That's so important. You need to see what the activity orders are and what the doctor is allowing them to do after all their hard work on doing the surgery for the patient. And in order to have the patient recover safely, you want to make sure you're following those guidelines. So we've got sternal precautions, which is sternal precautions. So say they just had like a cabbage, they had heart surgery, you'll need to follow sternal precautions. You know, the BLT, no bending. Oh, sorry. I'm getting carried away here. But anyways, if you want me to go over sternal precautions and all the other precautions that I had to do in my, I'm getting so excited, I'm losing my words, guys, that I had to do in my acute care field work, write it in the comments below that you want to see this. I need to know, guys, if you really want to see more about the precautions and want me to go over them with you, the hip replacement, sternal precautions, and there's many different hip replacements approaches. You've got the anterior lateral, and posterior lateral, stuff like that. Let me know. I won't be doing it in this video just because of the sake of time. And again, I'll be providing you guys with these resources in the description box below in the Google resource folder. Now tell me if that resource folder, you're finding it helpful. I'm not the most tech savvy, but in school, that's what I used. I use Google all the time for working on projects with others. And so that's what I know. And if there's other things you recommend that are free for me to use, then let me know. And I can check it out if it makes it easier for you guys. Because that's accessible and manageable is what I want for you guys. Now this, many of you guys have probably seen this, energy conservation. This is important. Oh, I always jump the gun. I'm sorry. This is not energy conservation. But you do need to know that. The 4 Ps. What's your 4 P, guys? 4 Ps. Write in the comments below. I'm having so much fun. Okay, so activities of daily living after getting a pacemaker or defibrillator. So this is for your, if the patient had a pacemaker replacement or pacemaker placement, those are precautions you'll need to follow. And then we have upside down. Oh, this is the second part to it. But there's other stuff that I don't have here handy for me to show you guys, but other things that are important are the Ranchos Amigos scale. and the Glasgow coma. So if you're working with someone who had a brain injury, you know, a traumatic brain injury, or has something going on in their brain, then the Ranchos and the Glasgow coma for knowing their level of consciousness and what stage they're at. That's going to be important. You're not necessarily going to have to write down what Ranchos level they're at, but many times I found it helpful because when working with a patient with a traumatic brain injury, if they had, a lot of times they were at the stage of 4 or 5, they were a bit agitated, combative, aggressive, so they needed to have restraints, unfortunately, but they need to have restraints, and they're a mix of calm and getting more oriented. But that was important because I followed what the recommendations were for each of those levels, and that was so helpful. I'll try to find that resource for you guys because that was super helpful for me. And if I think of more stuff, I will put that in the resource folder. And okay, so this is also a really good thing for those of you who are going to be OT students in the future. You're gonna find this resource folder very helpful, or at least that's the goal, because when you do your assimilated checkouts, where you are in an assimilated patient encounter, you might find these resources very helpful. Granted, you might be looking more for intervention type of stuff, but you also will need to know your precautions when you're working with the patient, and the Ranchos level, you might have that too. So and just in your studying in general, you'll find these resources are going to be very helpful. Again, that's the goal. So if you find it helpful, write in the comments below. And like this video, show me that this video is helping you, please, and that you want more. And I do like to hear from you guys. So please do like and subscribe. I appreciate you guys all so much, and that's also what gets me motivated and persisting in sending out the videos and creating videos for all of you. So again, let me know what you want to know more about for acute care, for fieldwork, for wanting to get into the OT program. I can talk anything OT because I love OT. I so love OT. And also public health. So I may not mention public health very much explicitly, but a lot of what we're doing is also public health because it's prevention of problems and it's building that quality of life, but this way particularly through doing. And in kind of less population-based and more individual because I'm doing field work and working one-on-one with people. So for all of my public health friends out there, if you want stuff related to public health and occupational therapy, let me know. I had also thought of making a video on public health and occupational therapy, how they relate. If you want that, write it in the comments below. Because again, I listen to you guys so much. I appreciate you guys so much. So please do tell me what you're thinking, share it below, and you can totally make yourself anonymous if you're not one who's comfortable with sharing. I am not judging. I am only loving everything. Is that judging if I'm loving it? But anyways, share, comment, subscribe, and like. Thank you.